Great. So hello, everyone, and good evening. Welcome to the Diversity in Medicine webinar series. We started these during the pandemic, and we've sort of picked them back up again after a little bit of a hiatus. And so we're excited to see some new faces from our post-bac programs. And hopefully we'll have some people join. I know we had some people who are actually alumni sign up, so hopefully they'll join us soon. A few housekeeping notes as we enter, year 3 of the pandemic. If you're not speaking, please keep your mic off, but please try to keep your camera on if possible. We try to maintain an open and engaging atmosphere. Please feel free to ask questions. This is for you. So we want to really give you the opportunity to have your questions answered, to find out what you want to know. So please, if you have a question, feel free to speak up, put the question in the chat, raise your hand through the little function, however you feel comfortable doing that. And yeah, I think that's it. Let's get started. I'll start with a brief introduction of our speaker tonight, Dr. Jay Graham. Dr. Graham is currently an associate professor in the Department of Surgery at Albert Einstein College of Medicine and the surgical director of the Pancreas program, as well as the ASTS Fellowship Program Director at Montefiore-Einstein. Dr. Graham did his undergraduate education in California, although we won't hold that against him, and his medical education and residency at Georgetown University in Washington. He did his fellowship training at Mass General in Boston, and I know he did a lot of research there as well. In addition, Dr. Graham has extensive clinical responsibilities and educational responsibilities, but he also has a business background. He is an entrepreneur, having started several companies to help with the health of his patients, and he is here tonight to talk about transplant surgery, the path to general surgery, research, and more. So welcome, Dr. Graham.
Thank you so much for having me. Again, sorry I was late.
Not a problem. So why don't we start with you giving us a little bit about your background, what led you into medicine, and what led you to surgery specifically?
I mean, that was a very nice introduction, to be honest with you. I mean, so it's been a long path, but I think it's been a very rewarding one. I started off at UC Berkeley, Georgetown, Mass Gen. I was at Columbia. Where else did I go? I was at Yeshiva for some time too. But along the way, I enjoyed every single part of it. In fact, I sort of look back and I lament a little bit, and I sometimes, wish we could go back to some of that, when I was doing a lot of the studying and things like that. But it's been very rewarding. I became a transplant surgeon, I think, because I always wanted to give people second chances. And so I think in transplant, ultimately, you really have the opportunity to give people second chances. I do liver, kidney, and pancreas transplant. I just did a kidney transplant today. And you always sort of look in the patient's eyes, and they're always so grateful, I think, and so that to me is never lost on me. So yeah, that's sort of my journey. I sold a company recently. I started another company. I think that was my MBA background, which has been pretty interesting, and really to sort of come at sort of servicing and helping patients in a different sort of way, which has been great. But I think ultimately, I've tried to sort of remain humble and sort of tried to sort of encapsulate in my mind that we're in this for a higher purpose, and the higher purpose is really to sort of help each other out. And so that's sort of how I sort of approach most things in my life.
Great. So looking back when you were a med school student, what drew you to surgery specifically? Did you always have an idea that that would be your path, or was there an experience in medical school that sort of led you to that choice as a specialty for residency?
That's a wonderful question. I think I wanted to be a psychiatrist, to be honest with you. I was reading a lot of books on psychiatry. I think in some ways psychiatry and surgery, you really sort of get to sort of change people for the better. And so I think ultimately I just sort of was more maybe drawn to some of the more tangible results you can get a little bit quicker. And in surgery, not to diminish anything in psychiatry. I really enjoyed my time on the wards there and things like that, and talking to patients. I read a lot of books, like I said before, on psychiatry. But I think maybe surgery just maybe fit my personality a little bit more. I think I would have been happy either way, to be honest with you. Um, I know that's just sort of like totally two different divergent, like, fields basically, but in some ways I think they're somewhat similar. Um, I probably need psychiatry now sometimes if I really think about it. But I think, yeah, I became a transplant surgeon, and ultimately I did general surgery, and then I did a fellowship, and I became a transplant surgeon. And I think it's really sort of built for people that really, or the field is really, to me, I mean, all comers can come into surgery. I don't think there's one size fits all, but I think that anyone who sort of likes to sort of see a little bit more sort of immediate results, is probably more geared for surgery. I would imagine, like, as soon as I pull the clamps off and reperfuse organs, it's like immediately I see urine and things like that, or bile production, and it's really sort of very satisfying. I don't know if that makes me sort of like a simple person, but I mean, I don't know.
No, there's something, did you have an experience? So I know surgery is a long haul, right? It's at least 5 years. Was there an idea when you went in that you were going to subspecialize at the outset, or were you sort of thinking I'll do surgery and then see where it takes me? What led you to transplant specifically?
I think, like all things, I think you need to identify like a mentor in your life that, I mean, no person is an island, and so you really need help along the way. Sorry, I got Miles Davis playing. I don't know why it's so loud, but I think no person is an island, and so you really need help along the way. You shouldn't be afraid to ask for help, or link up with someone who can help you. And so I had a mentor that was a transplant surgeon that ultimately sort of helped me along the way through different phases in my life, from medical school to residency, and even now I still sort of like call on him and ask him for advice and things like that. But I think that's like, I think people go through medicine and think that they sometimes it can be a lonely time. You're like studying so much, you're in the library, and you're away from like your significant other a lot, if you have one. But I think ultimately, you should really sort of call on people as much as you can to sort of help you, and really try to really build a support network around you, because the field is a little bit difficult at times, and you really need sort of sometimes people to help sort of pick you up, and that's okay. I mean, I've certainly have relied on a lot of people throughout the years to help me out through some tough situations and things like that. But ultimately, I had a mentor who was a transplant surgeon, and then I just sort of enjoyed what he did, and just sort of just followed suit, to be honest with you.
Great. I'm just going to pause here. If anybody has any questions, feel free to jump in. I don't have to just be interviewing Dr.
I'm from
Grant.
California, so it's probably the weird accent that people don't really
This is
appreciate.
so we have a very New York based program. So, again, we won't hold the West Coast against you. We're not holding it against you.
No, I understand.
All right.
Jenny, you are not the right person to say that, since you went to school in California.
But I came back to New York. New Yorker at heart. So looking at your career, I know you talked a little bit about some of the things you liked about transplant. Like, what would you say if you were going to give someone an elevator pitch of why transplant surgery is just the field to go into? What would it be?
Again, I think it's because you really sort of interact with the patient on a real human level, I think. Usually they're in some pretty dire straits when you meet them, and you really sort of give them a second lease on life, and I think it's extremely powerful. I think it's extremely healing for the patient. I think it's also extremely healing for you as a physician, sometimes, to know that all of your work isn't in vain. You really sort of not only helped out a patient, but really the family as well. Sometimes you do the transplant for the family. I did the transplant today, and I went down to the family, the center, the caregiver center, and I could tell they wanted to give me a hug, but I mean, COVID, I don't know, it's a little hard. Everyone's fist bumping now, but they were extremely happy, and that really put a smile on my face, to be honest with you. But I think it's just that ability to like connect with people on a very real level, and give them a second lease on life.
And in terms of transplant, I know you talked about the immediacy of it. Do you have a relationship with the patients long-term, given depending on the organ, maybe? I don't know how it works in terms of how you treat them going forward.
Yeah, no, we do. There's some medical doctors that really sort of follow the patient. It's a multidisciplinary team, obviously. And so I think that we will sort of follow along, and we will see them in it's like the surgeons are always the best. It's kind of like to the chagrin of the nephrologists and the hepatologists. They're like, oh, you get all the accolades, because it's literally you walk in to the waiting area and it's like you're treated almost like a rock star. People are like, I know you, you're like a celebrity a little bit. But that's not a reason to go into it, but it does feel good. You've had a bad Monday and you walk in and people are like, thank you so much for giving me a transplant, another lease on life. So you will see patients over the years. Sometimes in the elevator, you'll see patients, to be honest with you, which is pretty remarkable.
Right. And in terms of the downsides to a field like transplant or surgery, what would you say have been some of the challenges you've seen?
Oh, I mean, real chat. Do you want real ones, or these are pretty young people here? I don't know.
No, we want real talk, as our Riccio used to say.
Oh, I don't know. Young people aren't ready for real talk. But I think hey, what's up? Hey, you gotta thank you so much. I think a lot of it is I think it does have a deleterious effect on your family life. Being in a field like this sometimes. I think that it's hard to sort of be emotionally available sometimes. I think that sometimes the cases are so hard that you need support and we can't understand. It's hard to really sort of be there for someone else when you need so much support mentally. Like I just did a liver transplant. I think I lost 30 units of blood. It was a crazy case. Patients didn't really, every time you have a bad case, lose a lot of blood. The patients the next day look like they're like, can I go to McDonald's? They look great. And they're like, you almost killed me, as a surgeon, mentally and physically. But I think that is probably the hardest part is just sort of family issues that come up. You're not able to be there a lot too sometimes, I would say. It's you want to be there, but I've missed a lot of he's so loud right now. I think you miss a lot of things, you try to be there for a lot of things. But then you also need to you also need to be there for yourself too, which is difficult, trying to balance all of that. I think when someone used to say surgery is like a jealous mistress or something like that, I really didn't know what that really meant, to be honest with you. But I think what they were trying to connote was that it takes damn near all of you sometimes, and it's hard to sort of give to your significant other, your family, when so much is tugging at you. And then I think it creates sometimes a little bit of maybe false or faux resentment sometimes, and that you can't understand why people can't resonate on your level in terms of what you're feeling. But they're just they're in the normal context of living their life in the normal world, and you just got back from a 30 unit blood loss case where there's blood everywhere, and so it's just, I think it's trying to marry those two dynamics and trying to figure out how to be there for your family or for your partner can be a little bit of a struggle. But I think, life is a work in progress. I think that social media and things like that tries to sort of portray life as perfect. I'm not on social media for this reason, but I think it tries to portray a more perfect life. But I think I think life is perfectly imperfect, to be honest with you. And so I think that it's okay to struggle as long as you're trying to get better and address the struggle. I think I think you should stop being so hard on yourself and everything will be okay, maybe. That was a long answer. I don't know. I feel like I'm on a therapy couch there for a second, but
I missed my calling, you know.
yeah.
I think I saw a question in the chat. Want to unmute and ask?
Oh yeah, there's 3 chat questions.
I can go ahead and
There's,
ask if you want, or
oh, did your
you're on
MBA
mute.
come before? Oh, sorry.
I'm
Someone
sorry, I had
asked,
a question and it was kind of like related to business, but then you spoke about, do you think that's just mutually exclusive to surgery, like the interpersonal struggles, or you think that's something that exists just within kind of like because of the commitments of medicine?
I think it's more exacerbated in surgery, you know, to be sure. I think there's so yeah, I think it's a little bit easier in different fields that are not surgeon based, you know. Just because it's like your hands on someone, you know, you're like it's like a very intense sort of feeling, I would say, you know, at times. So and then also the hours are just longer because the cases can be longer. Now that doesn't mean that you can't go into like fields where like a colorectal or plastics or like some other fields like maybe endocrine where things are a little bit more regimented, but at the same time there's still that intensity that occurs when you're sort of touching someone and someone is more importantly entrusting you to touch them and to heal them, you know. So it just becomes very intense. But that doesn't mean like again, I think that intensity sometimes you welcome it and you breathe it in and take it in, and then you try to do the best you can, and through guidance through your peers and through your mentors, I think ultimately you come out better on the others. I think I'm a better person because I'm a surgeon, but I think it's been a work in progress. And then someone asked, did your MBA come before medical school or after school, and how has it helped you personally? So yeah, I got my MBA after I'd finished all my training. Basically, I was a full-fledged surgeon, and I went back for 2 years and did an executive MBA. You know, I mean, MBA is just interesting. It just sort of teaches you how to sort of speak the language of like of money, basically. And so I mean, I always joke the best way to make money is to save money. That's what the MBA taught me, basically. But I think that ultimately, when you're thinking about like a lot of hospital systems are just they've become very business oriented, and so if you want to sort of speak to leadership about like new visions you have, it's good to, I think, at least have a handle on, doesn't mean you need to go to business school, but like maybe accounting or something like that, really sort of understand how the money flows. And again, there's other degrees, there's like MHAs and things like that. Again, I think MBA is, you probably don't need like marketing or microeconomics. I think macro was pretty helpful in terms of like understanding present value of money and things like that. But ultimately, if you're going to take one course, I would say the one course you should always take is accounting, because that is a universal language that even if you don't get your MBA, you will definitely use.
Great. Since we're on the topic of business and things like that, why don't you tell us a little bit about the companies you founded and how you found your way to that and what happens with your work there?
Oh, that's a great, yeah. So I started so a little bit lighter. The rest of that was so heavy there, I felt. So I started a mobile app company many years ago, and it was called Transplant Hero, and we recently sold that in July. I really sort of came at it from a way of helping people. So it was a mobile app that was used to help transplant patients on their journey of medication adherence, basically. Because I just got frustrated with the fact that we would spend all this time, and then the patients, you know, would not take their medication on time. I learned a lot throughout the process, basically, and I think I learned to be a little bit more empathetic, because I think it is pretty impossible for people to take medication. For transplant, it's twice a day, but even once a day medication, I think is pretty difficult for people to deal with, because life just gets in the way, you know. And so I sort of learned that while I was making the app and things like that. And it was recently acquired, and then we just started a new venture. I just had a meeting with the FDA today. Actually, it was pretty great. I had a long day, but the meeting with the FDA was we're doing a new peritoneal dialysis catheter. And peritoneal dialysis is another modality. Everyone thinks about dialysis as hemodialysis, but the other modality is peritoneal dialysis, and we're developing a new peritoneal dialysis catheter, basically to help patients. I guess there's if I think about it, there's like a common theme, a little bit. Like it's always trying to like sort of help people on their sort of journey to whatever, obviously for peritoneal, hopefully they get transplanted, but it's to help them along their journey.
Mm-hmm. So when you talk about those are two very different ideas, right? Like one's an app, one's a device. How did you, like, if you have this idea, how did you get to the point where you were operationalizing it? Like, did you find people to help you? Was that something that, your employer, like, I don't know if Montefiore has an incubator, like, what are the kinds of things, say somebody has an idea, what were some advice you would give to get it to the point where you're actually making it happen?
So I bootstrapped it, to be honest with you. I was just a brand new attending. And so I didn't and I wasn't like married at the time, or like I didn't have a kid. And so I just sort of paid for it myself. And that gave me, I guess, complete license and complete control to sort of do anything I wanted with the app. Certainly there's incubators out there and startup incubators that are pretty ubiquitous. Monty has, we talk a lot about starting one. We haven't started one like yet. But ultimately it was sort of like, I think in terms of like business, it's a little bit different than medicine. In that medicine, there's like a tried and true pathway. As long as you stay on the road, you'll be like, I mean, you might be the most successful, but you'll be okay. Whereas in business, you really need to like pound the pavement, get out there, and like I can't, like so many doors slammed in my face. I like would go up to people and they would be like blow me off and stuff like that. But I just kept going and kept like trying, and then like ultimately it just sort of like fell into place perfectly. But it wasn't because I just sort of like, in medicine, you just like, you go to medical school for 4 years, and then you go to residency for a couple of years, and then you like do fellowship, and then along the way it's just sort of laid out for you. In business, there's no real sort of true pathway, and so you just have to be on your grind basically, and just sort of like, just if you have a belief. I think the most important thing is to make sure you have a belief in it, and just try to just like just make it happen essentially. Obviously I paid for a large portion of it, and then ultimately what happens in business is that like, because I sold this company, then I was able on my new company to raise a ton of money to start that company, because it's just like one success, that's all you need really, is just one success. I guess it's like kind of like musicians. Like if you have one good album, then people are like, all right, like we're gonna like sponsor the tour and stuff like that and things like that. It's like, because of that success, I was able to then sort of like start a C Corp basically, and like sort of get all these investors to buy into the new idea.
Very interesting. Any questions while we, feel free, just unmute and speak up. There's no formality here.
You mentioned how being a surgeon, you're often pressed for time, yet you've been able to do a lot of your business ventures while maintaining your like life at the hospital. How were you able to do that? I know you mentioned at one point you weren't married and didn't have a kid, but how have you been able to continue to do that up to this point?
I don't know, you should ask her. She'll probably tell you I'm not able to, like they were over there. I don't know. I think that it's I think first of all, I get a lot of sleep, to be honest with you. I sleep a lot because I think it's important. Like I try to get 8 hours if I'm not operating, just to recharge the body and things like that. I'm a vegetarian. That helps too. No. But I think ultimately, you just sort of like need to work efficiently. I think a lot of times people get caught up in the minutia. No, it's different when you're in medical school. You need to get caught up in the minutia. Like the minutia is very important. That's because that's how the tests are written basically, with like minutia in mind. But like as you get older, I think you start to pattern recognize how to fix problems, or try to find people that can fix problems for you too. And so I think that I've been able to move in a way where I've been trying to be as efficient as possible. like right now in my company, like I'm a co-founder. So then I have a guy that sort of like raised the money for me, basically. Like he's better than I could ever do it. And then I have a person that works for me that's the operating officer that can probably operate the business better than I can. So I just really sort of speak to the medical piece, but it's just I think it's partnering. If I really think about it, it's partnering with good people, honest people that you can trust, that can really sort of shepherd through your vision so that I mean, again, you can't mitosis and be in two places at once, like today I did like kidney transplant, then I had a PD catheter, and then like I had another meeting, and then I had another like PD catheter, then I had the FDA meeting. But along the way, I had people helping me sort of smooth that process out. So it wasn't all. I think the fallacy in all of this is that it has to be all you all of the time. I think you need to do your homework and have your fingerprints on it. But I think that you need to also recognize that there are good people out there that can execute your vision, or at the very least, you can marry your visions together to make an even better one. To be honest, yeah.
So I have a question, and might be a little bit in the weeds, but you do transplants of a number of different organs. Is that normal? Or, is there like a person who does kidney transplants and another person who does liver transplants? Or is a transplant surgeon for any organ because it's basically the same but different?
No, it's a great question. So most transplant surgeons do like sort of choose what to do, basically either kidney, or the major division is kidney or liver. And so I just sort of started off, I was multi-organ, and then they just sort of needed people to be multi-organ at my institution. So I sort of stayed that way. But it is a huge challenge, I would say, to stay multi-organ, because the demands on each organ system are a lot, basically, because the kidneys are one thing. There's a lot of kidneys coming in all the time, but then the liver takes so much out of you to be able to do properly. It's a bit of a challenge. I'm not sure like I can continue to do all the organs. I may need to choose. Most people choose like liver, but I'm the incoming kidney director, so I don't know, maybe I'll stick with kidney. But I sort of do everything at the moment. I even do living donor nephrectomy, which means you take the kidney out of a living person to give to another person. Which those are the true heroes in life, to be honest. That's what I was doing. Someone was doing a living donor nephrectomy, and then they gave me the kidney, and then I just implanted it, basically. But it's a great question. I know at Columbia, like most people were kind of divided. Cornell, definitely Cornell. There's a huge division. It depends on the institution, but I would say it also depends on Malay. That's her name?
Mahalate, but it's not.
Mahalat.
Yeah.
Mahalat. So I think that's sort of like yeah, it depends on your balance in life, if you can maintain it or not, to be honest with you. But I think you're a medical student, or you're
I'm a post-bac.
Post-bac. Okay. So I think, yeah, I mean, just a quick thing about post-bac. I think it's an incredible opportunity to really sort of sit down and really sort of hone your skills. I'm going to say something that's probably I shouldn't probably say, but the best way I always felt to do well in medical school was to get there would always be old tests, basically, or like the professors give you old tests and things like that. Because I think that where people get into trouble a little bit is that they try to be the master of the textbook. And I think that is fine if you have years of your life to devote to a particular subject matter. But unfortunately, or fortunately, or I think it's unfortunate, the tests are written in such a way that they're just picking out just very little minutia that is relevant sometimes to like the professor, relevant to how they sort of feel about the material, which may be a little bit different than how you feel about the material. And so the best way to get to know like the style of the professor and what he or she is looking for is to really sort of like, the best way to understand their psyche, like, right? Like you're trying to understand the psyche of the person who's like testing you, is to really like ask them, you can ask the professor, do you have any like old tests or old questions that you have asked in the past that may be relevant to the test that's coming up, and really sort of study. Like I always studied backwards. I would use the textbook as a way to sort of frame, or to fill out the conversation, but to frame the conversation, I would always use. And it's not like, I mean, these tests were given out to everyone, to be honest with you, but like, it's just to go to the professor and say, hey, is there a test taking like question or something that you like to ask on the test that I can sort of study from, and then I would just totally work backwards, basically. And I've experimented. I've been in school so long. I've experimented with a lot of different ways to study, and I thought the least effective way was to sit down with a textbook. I think another effective way was to go to the TA's office or some assistant's office, or go to the professor's office. But the most effective strategy that the best I ever did, it's almost like how we study for the MCAT, to be honest with you. You just take old MCAT questions like over and over and over again, and you get to like understand the pattern of the questions and things like that, and what are the tricks, and so you can at least give yourself a fighting chance, like 50-50, to get the answer right. I mean, but it goes into like, do I feel like multiple test questions are really sort of fair assessments of people? I really don't think so. But I mean, that's what we sort of like have. I don't think it really tests your sort of IQ or how smart you are or how dedicated you are. I think it just sort of tests your test taking ability and your ability to sort of like really sort of like figure out, like, usually people tell each other, but figure out that like, when I study for the ABSCITE or the MCAT or whatever standardized test, I literally, like when I did Princeton review, and also when I taught Princeton review too, we would just like go over like old questions like ad nauseum, basically, to figure out the patterning in these questions, basically. I hope that wasn't, hopefully I didn't say too much. Hopefully I didn't get in trouble like that.
Speaking of standardized tests, I know, the change in step one and going forward into a residency is always like it's a topic that comes up a lot these days. When you've obviously had a lot of educational experience in dealing with residents, looking at applications. If you were going to give advice to somebody looking from a med school perspective, like, I'm going to be applying to residencies, I think I might be interested in surgery, I want to distinguish myself, what are some of the things you would give as advice to somebody in that position?
Well, I see for step one in particular, or just in general?
No, just in general, because I think, especially now that step one's going to be pass fail, I think
Yeah.
a lot of people are thinking, how can I distinguish myself? How can I, make an impression? What are some of the good tactics to look into?
Well, it's good it's going to be pass fail, because before you had to like kill step one, like the scores, like I don't think I would even get into residency based on some of the scores that I was seeing, basically. But again, they were like just testing for people that could like had photographic memories, number one, or number two, could like just test take very well. And that doesn't really mean that you're going to be a successful surgeon, to be honest with you. Actually, that ability probably doesn't translate into what's being success. Being a hard worker is what sort of translates into being a successful surgeon. Being sort of like, some people are just gifted at it too, to be honest with you. But I think ultimately, your question's a good one. I think that like how to distinguish yourself. I think that I think the most important thing probably is to do like a little bit of like research. I think helps out a lot. I did a lot of research throughout the years, clinical based research. I was lab based or bench based research for a long time as well. I think we, like, when I look at CVs, I always look for it. Not that I'm necessarily looking to like see what your articles are about, but just to show that you have given back to the community of medicine, and you've given back to the tribe, basically, to really sort of push the field further. It's like if we're gonna like sort of impart on you the wisdom, like at least like show that you're willing to sort of like help advance the wisdom yourself, basically, is what I would say. So I think research is probably the biggest thing. And then I think with research too, you start to meet people that can start to like advocate for you and things like that. Like I did 3 years of like research like during my residency and things like that. And that really, people like still email me about stuff like that. Uh, um, today. So I think it's pretty important to probably think about that. I mean, there's clinical research too, where you can do database mining. I used to do that a lot. It's not really my favorite anymore, but I still do it from time to time. But I would certainly advocate for that. But just to go back to the test taking just for a second, I think that there, I see a lot of like brown faces on here, and obviously, being African American, I think that there's a lot of pressure on maybe sort of like proving yourself maybe or something like that. That proving that you belong in a certain community. And I'm just here to say that like you should let all that just wash away. And you're not here to like really prove anything to anyone. You're just here to like sort of almost just perform to the best that you can. So I think a lot of like maybe like people get lost in like reading like again textbooks and things like that, or like trying to like sort of be the total master of something, is probably, I would say that's probably people that are brown are probably not encumbered with the same sort of anxiety that surrounds the need to sort of prove that you exist in this environment. And so I think that when you're in post-bac or medical school, and you just need to perform in a way that shows that you can sort of assimilate the material and be able to learn it in a way that is applicable to like what the professor is sort of like putting forth, basically. I know that's hard to hear. I think it was hard for me. I came from UC Berkeley, so for me it was like, I loved getting in the weeds and things like that. And then, but sometimes that's not really what life is. A little harsh, I think. Sometimes that's not really what life is about. And I think if you sort of get lost in the context of trying to like sort of prove your worth and things like that, you sort of lose sight of the fact that no, that wasn't really the question on the exam. This was the question on the exam, basically. And even though you're an exceptionally smart and bright person, it's reflected in a way that you're not, because it's a standardized test, is what I would say.
And speaking of coming from backgrounds that are underrepresented in medicine, going into surgery, which historically has been so white and male dominated, how did you find the culture? I mean, do you find certain institutions maybe better than others? Have you just made your place in it? If you wanted to talk a little bit about how that's been for you.
Yeah, I think it's always a bit of a challenge, to be honest with you. There is a bit of isolation, I think, that comes for being the only like brown face. Like right now, I'm the only like Black transplant surgeon in New York. That's a little bit lonely at times. But I think that this is life, and I think that you just sort of persevere and try to do as best as you can by sort of, again, like establishing a support network and things like that to really sort of help you through. Life is unfair, but that doesn't mean that like you have to like sort of, I guess, succumb to like some of the pressure and things like that. I think it just sort of, you look for an avenue to sort of ease the pressure and maybe approach things a little bit smarter. But I think that there's like, for sure, there's prejudice and racism in medicine. And, like, you have to like, there's all these microaggressions all the time. Even in the Bronx, there's microaggressions. Where I work, but I think like you just sort of like battle through, and ultimately, you become a better person, and ultimately you help your patient heal whatever ailment they have. But it's not, I mean, I sort of say that like as if it's like not hard. I think it's very difficult, and I think it's okay to admit that it's difficult, to be honest with you. I think that the best part is just, or the better part of valor is just not to let it sort of like impede your progress. Because ultimately, I think like the cream, my mother used to always tell me, the cream rises to the top, basically. And so I've sort of bear witness to that. I think whenever I get bogged down and feeling that so and so doesn't like me because of my skin color or my hair or whatever it is. Like, it's just like, that's their problem. Like, I have the chops. I'm probably the best transplant surgeon in New York. I think that's pretty arrogant. Maybe one of the best, I should say. But and that's good enough for me. And actually I tell patients that. So that's probably pretty shameful. I shouldn't say that, but I tell them I'm the best. They go, "Who are you?" "Oh, I'm the best." But I think that I think that's just sort of how I approach it.
Praise, I saw your hand was up.
Dr. Graham, I had a question. Are there any, how do you foresee the field of transplant moving forward in the next 10, 15, 20 years? Are there any exciting avenues for innovation in terms of development, allocation even? Yeah.
Not really. I don't think that's a good question. I think that transplant is sort of like one of these like fields that is sort of, until they come out with artificial organs. I mean, you heard about the NYU article. Bob Montgomery, who I know, did that with the pig kidney, but even that is still really surgery. I think until they come out with a more sort of miniature version of these like sort of artificial kidneys, I think that transplant, big surgery is sort of here to stay. Basically, the liver transplant, a big surgery. So I think if you're the type of person that sort of like is like maybe a bit of an old soul, I think transplant, there's not a lot of innovation in it, and maybe that's why I sort of maybe overcompensate by starting businesses and things like that, because there's not a lot of innovation. But at the same time, I think that there is a lot of romanticism that happens in transplant, because it's like you're doing the same operation they were doing like 30 years ago, basically, and you can like get in to a social setting and really sort of like talk the same way with the older generation, because it's the operations haven't really changed that much, basically. In the future, I think that the pig, the xenotransplant's going to probably take off. And then I think maybe in 100 years, I think artificial, like truly artificial kidneys, like robotic, like machine made, will probably be amongst us. But I think we still have a lot of time for that. Yeah, I think the one thing about transplant, or just medicine in general, like people get upset, but there's a lot of inertia. So, I think sometimes it feels like very comfortable. It doesn't, the water's always warm sometimes, and the water is always calm in medicine generally. There's very few like huge storms. I think it's that way just so that level heads prevail and things like that. But it's a very slow moving, like people always complain in technology. Like my founder's a tech guy, basically. So he's just like, wow, things are, but I think there's a lot of comfort in that, and again, it does feel like a bit romantic at times to really sort of like talk through some operations that people did 30 years ago with someone who's like 30 years older than you.
So I have a question about mentors. You mentioned you've had numerous mentors over, the course of your education. So how do you choose a mentor? And does the mentor have to be in the same field that you're in, or can it be somebody who is in a totally different field but can help you get through some of the maybe emotional or psychological issues that arise when you're in school?
Yeah, no, I think that they don't have to be in the same field that you are in. I think it certainly helps if they are, but they don't have to be. I think that anyone that I think what you're looking for in a mentor is someone that is empathetic and open. Not everyone is, so it doesn't mean like if you approach someone and you're like, whoa, that was a weird sort of interaction. First of all, people have off days. Maybe they got in a fight with their wife or husband, or who even knows. Kid yelled at them. My kid yells at me all the time. But I think that like if there's just not a connection there, But I think if you find someone that can empathize with you and can remember what it's like to be a medical student, I think that's important, to be honest with you. And really someone who you can sort of talk to. I think the most important thing though is that you have to sort of like, if you are going to pick a mentor, you have to sort of show up I think what I've seen a little lately is that people don't really, I guess it probably comes because of COVID, but in general, people aren't as around as much. And I think that that is sort of maybe something that's lost. I think, like, for example, on the weekends, like I operate on the weekends a lot, and I rarely see anyone, other than my fellow who's assisting me and things like that. And that's a great opportunity because at the weekend things are slow. We're doing a case. We can chat about anything basically. So I think it's just like sort of, I think a lot of it, what is it, 90% of like success is probably showing up. I think that is the same for being seeking out a mentor as well.
Any other questions? Again, feel free to unmute and ask.
Do you see yourself in surgery in the next 20 years, or do you think you'll transition into the business side of things?
Well, I think that in surgery, like, so it's a great question. I think about it all. It's very existential, to be honest with you. So I'm 46, like, so like the type of complexity that I do, I'm just not sure that I can do it like for another, like I think 15 years might be the limit for me. Just the operations are so technical. Like right now, like I don't have a tremor. I feel very comfortable in the OR. But I think you have to be realistic. Like think your body changes, your mind changes, like things change. And so I think that like to think that you can do what you're doing, like for example, like I was lifting weights yesterday, I almost killed myself. I was like trying to do what I was doing when I was like 22. You can't do it basically, and that's okay. You get older, and there's grace and dignity in that. And so I think you just need to recognize that. And so I guess the answer to your question is probably in like 15-20 years, probably something more on the entrepreneurial side, recognizing that it's probably, I think there's a lot of, like, it's not that I wouldn't want to, but I think that you just need to recognize your limitations and recognize that it shouldn't be about you. It should be about the patient. And if you feel like you're not able to provide like the level of medicine that you were before, then it's probably better to like try to like provide that level of expertise or whatever it is in a different avenue. And that's okay. I think a lot of people get in trouble when they try to like sort of they marry their identity to like some field or something like that. And I think that we are always evolving as human beings, and it's okay to like sort of go on a different path a couple years later. No, I think it's perfectly okay.
I have heard of some programs that actually limit surgeons by age. I think Pittsburgh does that, where they say like once
Yes.
at a certain age.
Yeah, 65 is usually the cutoff for people, but people in the like a lot of places do not. But I think I'll probably self-limit.
Oftentimes when we discuss addressing disparities in medicine, at least what I've heard, the conversation surrounds going into primary care, but it sounds like you've been able to help address disparities in your field through Helping Hands, and it sounds like your business ventures as well. I was wondering if you had to go out of your way to find those opportunities to help just address disparities, or were they like readily available?
How did I was Helping Hands? Yeah, we do a lot of, that was like that's a charity that through Monty, but good job on your homework there. I think that so do I search for that? No, I think it just sort of like, I think I'm just like a person that really sort of looks to sort of like help maybe the that doesn't mean like I'm like always giving like money to like homeless people. I'm not trying to portray myself as a saint or anything like that. But I just think that like I like working in the Bronx because it is 40% below the poverty line, and you do get to really sort of feel like you're doing like God's work, whatever God you believe in. I feel like it's like you really feel like you're doing that and really sort of helping the least fortunate among us. So I think that like again, you can kind of pick and choose where you want to work ultimately, and so I think I found the most satisfying. I've been at a lot of institutions, famous ones, but I've found the most satisfaction in the Bronx, to be honest with you, because it's like the patients are very thankful, and then you realize you're providing better, like as good or even sometimes better care than they would even get at like some of the top flight institutions and things like that. And so that's pretty heartwarming to know that, you know, someone on Medicaid who's, you know, making no money, still getting the level of care that, you know, a hedge fund guy is making down, you know, 71st in York. Not to pick on Cornell or anything like that, but I think that has always been the top of mind for me. But I think, like, to your question, I think it just, maybe it found me. I just think that, like, I always gravitated towards some of these opportunities for sure. Like, I'm a member of this charity called, I'm a board member called Northside. We help out children in Harlem and things like that. So I think if you're not giving back and bettering your common man, like, or woman, like, it's just like, what are you doing, I guess? Like, what's the measure of your life at that point? You know, it's not the point isn't just to live life, it's to live life, I guess, with a purpose.
Last few minutes, so questions, just
Okay.
go right ahead.
Yeah. How, just had a quick question about how do you create your goals, and how do you typically deal with challenges or failures in terms of achieving those goals?
So, like, goals, like, it's, I think in medicine it's a little bit like more laid out for you, to be honest with you. So I just think that, like, I would just sort of, you know, to be honest with you, I would talk to my peer group and sort of try to figure out what their goals were, see if they aligned with my goals, and just tried to figure out what made them happy and what made me happy, basically. And then along the way, like, I took on this new position, and that was really sort of, I wasn't looking for it, but I just was like, I'll help out, you know, to be honest with you. Um, but I think that, you know, my goal all along, I think, was to just sort of be the best surgeon I could be. Like, if you just minus everything out, that was my only goal. And so I just approached that with just steadfast, like, dogged determination to be I was always in the OR. I was doing the most cases. I was like, I'm going to be the best surgeon, you know, and I think I accomplished that, you know, to be one of the best. And I'm pretty happy about that. And then along the way, a lot of these other things fell in my lap. But I think ultimately, that was my primary goal, is to be the best, because I think ultimately I didn't really want to hurt anyone when I really think about it. And so I think if you don't want to hurt anyone and you want to provide the best level of care, then you have to, like, train as hard as possible. So, you know, I did medical school in 2000, and I went all the way to, like, 2014, so 14 years basically of training, basically, to try to be the best, basically, which I'll tell you, I enjoyed every step of it, to be honest with you. I would do it again in a heartbeat, to do it all over again. But yeah, what was the second part of your question? Sorry, I was waxing poetically.
Yeah. The second part was, what's your approach to challenges or failures in terms of achieving the set goal?
So I don't think that I have the best sort of ability to sort of I think I'm an effective leader, but I think that, like, at times, I think with, like, you know, brown people, black people, I think that there's a bit of chip on our shoulder sometimes. So I think that, like, sometimes I meet, like, a little bit of, like a little shove in the back with, like, a full-fledged like I just, like, I probably shouldn't even talk about this, but I just, like, I'm very, like, I can be a little bit like, overcompensating in that way, in terms of, like, trying to just sort of, like, protect what I've, like, accomplished and things like that. And I'm not sure that that is the best way to sort of go through life. I think there's probably better ways to sort of deal with conflict and things like that. I think the best way, though, is really sort of, you really need to, like, do homework on people and figure out what makes them tick, because a lot of your bad interactions are not really you. I would say they're really sort of like, everyone has insecurities, right? So you just have to figure out what people's insecurities are and how to sort of navigate around them a little bit to have better interactions with people. I've had like, I'm just thinking recently, I'm having like a bad interaction with like someone who works for me. And I just sort of like, I decided instead of just sort of approach it like how I would approach it, and like sort of like, we're surgeons, like we're gonna like, I just was like, I killed her with kindness, and we had a great case the other day, you know? So I just think like one size doesn't fit all as you're trying to navigate through people. People are very complex. A lot of people come to you with a lot of baggage that was even before you, and a lot of their hostility has nothing to do with you, to be honest with you. So I think that like just like trying to figure out like how to what people's insecurities are and how to really sort of like either like make them feel better, or just sometimes you may even just need to like navigate around too. Some people are just, you can't fix. But I think that that's how I sort of try to deal with a lot of obstacles that sort of come in my way. And I think I think that you don't want to have a blind spot is the biggest thing. I think as you get older, and you guys are older, you're older adults now, I think that you realize that life presents a lot of challenges, and you don't want to stick your head in the sand. You want to try to figure out, sort of see all the complexity and the issues and things like that, and really try to really sort of maybe even be empathetic. Even if you don't really understand this person's position, try to understand the position from where they're coming from, basically. And that's what I did with this last sort of confrontation. And I'll tell you that it was like, we did this liver transplant together. It was like night and day. It was like, I was like, oh, I should have done this like 2 months, 2 months prior, you know? But I think that, again, it's life. It's about learning. And so I think that you don't want to maintain a lot of rigidity. I think you have core principles and core morals that guide you along the way. But I think that you have to recognize that everyone is living as beautiful and as an expansive reality as you are, most likely. And so you just need to recognize that.
All right. Well, on that very existential note, I'm going to call one more call for questions before I wrap up.
Was fatherhood something that was planned, or did it come just out of nowhere? And how was that navigating? Because I'm interested in that someday, but it's scary to think about the side of responsibilities plus the biggest responsibility, I think, being a parent.
Well, you know, it was planned. I think that like I think it's been the best thing that ever happened to me, to be honest with you. But I think that like I don't, you know, I vacillate back and forth. Sometimes I think I should have had children younger, you know, because when you're younger and you have children, you know, the children are acting in a certain way. And when you're older, like I'm in my 40s, it's hard to like sort of change your personality to meet them a little bit. But I always felt like if I was younger, I could maybe sort of mold myself a little bit to sort of meet them a little bit from where they're coming from, because they're coming with their whole unique perspective, and they're their own entity, right? And so you have to respect them. You know, my son's 2.5. But when you're older, you know, like, you know, you can provide more, you know? And so I think it's just different levels maybe of, I think it all comes down to anxiety, to be honest with you. And then you need to sort of, everyone talks about their partner, right? Like, so the getting the values is easy with your partner, but really sort of understanding like your partner's insecurities is probably paramount, because that will come out when you're raising children, because you always steer your children away from your insecurities. And if your insecurities are different than your partner's, there'll be a lot of sort of confrontation along the way. So you really need to sort of like talk through that in a calm way and an understanding way to really sort of get to know who you're raising your child with. I would say it's a huge learning opportunity, I would say, but I think it's been ultimately a true blessing for me. I think that it gives you, I mean, there's a lot that you give up though. I would say that I don't work out as much, you know, and things like that. You eat a lot of French fries too, which is probably not good for me, because he's but I think ultimately they sort of guide you in a way that is ultimately a more beneficial path and a more selfless path. for you. And so no matter what you're doing, like even if my job's crazy, I'll still come home for like 2 hours just to take him to school. And just seeing him in school means the world to me, to be honest with you. And so I think there's a lot of like, it just feels very like, it's one thing to go through surgery and be the best surgeon and be the best at this, that, but to really sort of like genuinely feel love for another person and to feel that love returned. I don't think it's just like, I think it's nothing that can replace that.
All right. Well, thank you all for coming, and thank you, Dr. Graham, for taking this time to talk to us. We really appreciate it. I will make the recording available on our website. I'll send around the link. Another plug for Diversity Advocacy Day on March 1st. Callie's going to put the link in the chat. You can just register. Again, I'll send out the schedule. If you have 30 minutes to jump on a meeting with us, we talk with state legislators about the importance of the Diversity in Medicine program, and this is all in the goal of making sure that we get our funding this year for the base programs and also to add in money for the scholarship program. We've been getting money for the scholarship program for the past 5 years, and a large amount of it comes from the state. So we really need to make the case for them that this is an important use of state funds. I know, Juan, you might want to join us if you have a chance. So yeah, please do. I'm happy to send you any additional information and answer any questions you have. So please feel free to email me if you need anything.
Can I just put in a little plug for Juan? And quite honestly, I don't know, Praise, where you're going to be going to medical school, but Juan is at Einstein and Malit is going to go to Einstein. So just thought I'd let you guys know that Dr. Graham's there, and Dr. Graham, for you to know that they're there. So, and Praise, where are you going to go to medical school?
I'm actually a fourth year at Upstate. SUNY
At
Upstate.
Upstate.
Yeah.
Oh, you're a fourth year. Oh,
Yeah.
all right.
Thank you.
Well, you've got some decisions to make.
Waiting.
I'll be in touch in a couple of weeks about match.
That was good. 2 weeks. 2 weeks out.
Oh, right.
Yeah.
Congrats to everyone doing the post back, and I can leave my email here for anyone going to Einstein if you guys have questions. You know, I'm always open to talk. So
Great, thank you. All right. Okay.